What's up guys, welcome back to my channel. I'm Dr. Yaz.
And I'm Dr. Feroz. And today we're going to talk about everyone's favorite topic, STDs.
Who should get tested and could you have one, and how to prevent them? Before we begin, please don't forget to subscribe to the channel, and that way you'll get notified when new episodes come out.
STDs, or sexually transmitted diseases, and I think no diagrams are needed for this, I think they know what we're talking about, are diseases that are transmitted through sex. That could be either oral sex, vaginal sex, or anal sex.
STDs can be caused by bacteria such as chlamydia or gonorrhea or syphilis, by viruses such as HIV, HPV, genital herpes or hepatitis B or C, and by parasites such as trichomonas.
First, let's talk about how not to get an STD. Simple, just don't have sex.
Or you could use a condom, but you have to make sure you're using them consistently and correctly, as they are highly effective in preventing most STDs.
There are vaccines for prevention of high-risk HPV and hepatitis B. For some people at increased risk of HIV infection, a medication known as pre-exposure prophylaxis, or PrEP, can significantly reduce the risk of HIV transmission, but it does not reduce the risk of other STDs.
And we will be talking about PrEP in more detail in one of our upcoming episodes. Other prevention strategies include reducing the number of sexual partners and also avoiding risky sexual behavior. Should we explain what we mean by that?
I mean, if you do it, you know it, right?
Moving on. Who should get tested for STDs? First of all, anybody with symptoms of STDs needs to get tested, and that's why it's very important to recognize these symptoms.
Symptoms of STDs can include things like burning with urination, vaginal discharge, penile discharge, sores in the genital area, fever, or abdominal pain.
It's also important to know that many people with STDs may not have any symptoms, but they still need to be treated. The CDC recommends the following screening guidelines.
Diagnosing STDs is quick and easy. It usually requires a blood or urine sample, or sometimes a swab of the affected area. There are some clinics in the community where you can get tested for free and treated as well. Check the link below to find a treatment clinic near you.
STDs left untreated can lead to serious long-term problems such as infertility or pregnancy complications, and it can even increase the risk of certain types of cancers. However, many STDs are curable, so in the case of gonorrhea or chlamydia, a single dose of antibiotics may be all that you need. While other STDs such as HIV or genital herpes are not curable, there are medications available that can help manage the disease and its symptoms.
Finally, if you do test positive for an STD, it is very important that you have an honest and open conversation about it with your sexual partner or partners. While the conversation can be uncomfortable, it is very important that they get tested and treated as well.
Thank you guys so much for watching, and please always remember to be safe and take care of your sexual health. And don't forget to subscribe to the channel, and that way you'll get notified on upcoming episodes.
Can I give my Emmy Award speech now, please?
And could you have one, and how to prevent them? Before we begin, please don't forget to subscribe to the channel.
What? Rather, are my arms in the scene, or am I just like going, can you turn on the camera to see if my arms in the scene? Or am I just like a wacko person just
They are.